I know that everybody has really wanted to know about vaccines. And one of the issues I'm going to have is I have a lot of information that really isn't going to answer everyone's questions. As we know, the FDA did meet yesterday in a vote 17-4 with, I believe, one abstention. They moved it forward to the larger body, and we would expect that vaccine will start distribution most likely this weekend to the different states. From Pfizer, Moderna's meeting is next week. We expect that approval to go along the same lines, and then that vaccine will start being distributed across the United States. The state will receive this and then distribute. It has 10 vaccinator sites, or 10 hub sites. We are not one of those particular sites. However, we will get vaccine very rapidly, just as they do. These 10 sites are where they're going to hold vaccine, mostly to distribute out. And then others of us larger entities that have gone ahead and gone through Show Me Vax and applied will be receiving our supply from them. We have no idea, and I repeat, I have no idea and have not been told how many vaccines we will receive. Whenever we receive that vaccine, we are to administer as much of that vaccine, if not all, to our Tier 1A group as defined by CDC in the state within 10 days. We will not be vaccinating in the nursing homes. That contract is through CVS, I believe, and possibly Walgreens, of which they have affiliated with them. We will be providing vaccine to our caregivers and will be working with independent physicians in our community on staff and those other entities to make sure that we are able to vaccinate at least the provider in those clinics from their employees. We have to see what the state says and how those affiliation agreements work. We hope to have vaccine just before Christmas. Depending on when that arrives, and this is very fluid, we will start vaccinations quite rapidly. If we receive this vaccine by, say, the 21st or 22nd of this month, we will start vaccinating before Christmas. Obviously, if we receive this vaccine around Christmas Eve or possibly even Christmas Day, we would start vaccination just after Christmas, somewhere around the 26th, 27th. At present, we have surveyed not only our providers, our physicians, our APPs, our CRNAs, our PAs, we have also surveyed our caregivers. We are getting a very good response, and the majority of our caregivers are saying that they will take the vaccine. I have said this before and will repeat it again. This vaccine will be optional. We are not mandating that our caregivers take this. As soon as we have the frequently asked questions, basically, from Pfizer and Moderna, we will be providing all of that information to our staff, and I am sure it will be on our intranet sites so that people will be able to be made aware of any, hopefully we can answer any question they have and allay any fears. But again, this will not be mandated. It is highly encouraged. This technology is not new. It has been around for a couple of decades. However, it is new in this particular setting. So we understand why there is some fear out there. However, right now the majority of all of our caregivers and providers are saying they plan to take the vaccine. Okay? When it comes to the general community, I know there's a lot of folks, and I've received calls, when can I get my vaccine? The general community needs to understand, most likely vaccination will not be available to them until the summer of this upcoming year. The reason is there is a large number of healthcare workers, first responders, and other people who are in nursing homes, skilled facilities, group homes, and those with other multiple conditions that will receive the vaccine first. And there is a stair-step approach that has been laid out by the CDC, which anyone can go to cdc.gov and look at what their recommendations are. They would also need to look at the Missouri government website, because Missouri also has the right, along with the county health departments, to kind of set certain standards in how they want this vaccine given. So with that said, I just want to finish by saying I cannot express my gratitude for all of those that come in here and work every day, from our physicians, our advanced practice providers, our nurses, our techs, our cleaning people, our facilities folks, our grounds folks, our cafeteria folks, our pharmacists. They are working tirelessly every day, picking up extra shifts and helping out their team. So with that, what questions would you have of me today?
I heard that there were a number of staff members within Mosaic that has tested positive. Can you confirm or deny that? And is it affecting staffing? Yes, we have had a number of caregivers that have tested positive. They've been testing positive now for months. We will, the number, I do not have the official number today. I know earlier in the week we had in the low 70s of caregivers out. And whenever I give that number, that would be across all different employment status, whether it be nursing, techs, dietary, environmental services, social work. I mean, we've had multiple areas. Yes, I'm not going to say that doesn't affect us. However, that's where I go into lifting up the team. People have pitched in. When one of their caregivers is sick and going to be out for a period of time, they have picked up extra shifts to cover them so that we can continue to provide that high quality care that we have been providing and continue to provide. I want you to know this is an incredibly safe place to get your care. Do not delay care, okay, because you're worried about getting COVID. You're probably safer here than you are if you go out to Walmart, to Lowe's, Menards, Home Depot, or any of the other local venues. Is staffing level adequate, though?
Staffing is adequate, yes. Yeah, staffing is adequate.
Is it in-house, or are you having to rely on some of the people coming in that you contracted with? Or?
Agency does help offset some of that, but it's also allowed us to give some respite to some of our folks that were doing a lot of extra shifts. That's where it's really helped us.
I know you talked about that the vaccine will not be mandated, but as of now, strongly encouraged, and that you've met a positive response. Mm-hmm. Has that been pretty standard for hospitals in this area, and why was that decision made? And then I guess the second part of that question is, will you, Dr. Laney, and other members of the administration be getting the vaccine in the 1A phase?
To answer the last part of the question first, yes, I will be getting the vaccine along with Dr. Laney and Dr. Kammerer. We believe in the technology, and we believe the technology is safe, and we will receive the vaccine. Many other facilities around us have not mandated the vaccine. Mayo Clinic, who we are part of the Mayo Clinic Care Network, has not mandated the vaccine. They too are highly encouraging it, and we are really following their lead. We've worked with them, looking at what are their processes, what are their plans, and that has been a great resource for us, and that's why we're sticking with that, planning around that decision.
You said that we don't know how much vaccine we're going to get, but can you tell us how much you guys have asked for, and whether or not we might get Pfizer or Moderna, which way we're leaning? Okay,
we do not know which one we'll get. A week ago, I would have told you it was Pfizer. This past week, it was mentioned the state was going to get a fair amount of Moderna, and they did mention that they plan to use that in the more rural settings. The interesting thing is that sometimes we fall into a rural setting, and sometimes we fall into a metropolitan setting. So I'm not sure which one we're going to get. We have 4,000 caregivers that we employ roughly, okay? We're going to ask for the moon and the stars, and we'll see what shakes out.
But to follow off that, you guys do have the freezer capability for the Pfizer vaccine, if that is the one sent there, correct?
We do. We have a freezer here, we have a freezer in Maryville, and we have a freezer in Albany. We can maintain whether it be the ultra cold Pfizer or Moderna, which is kept in a more of a standard type freezer.
And I know you said that as of now that your hope is before Christmas to receive the vaccine. But if we don't receive the vaccine until later this month here, do you foresee any caretakers from this region, or whether that be Mosaic staff that could potentially travel to Kansas City or the most close area that Pfizer vaccine, that first round, is distributed to get the vaccine, to kind of make it to where less people need to be vaccinated here when it comes?
Right now, the way the state has put this forth on the way you're supposed to receive it, you're supposed to receive it where you are at. So unless the state changes and said, hey, we're not going to be able to distribute across the state, you're going to have to travel to somewhere in Kansas City. I do not know where these 10 sites are located. They have not disclosed. But if the state says that, then I guess we would have to send our caregivers in that direction. But right now, everything has indicated that we will have vaccine here to administer, here and at our in Maryville and Albany. And with that being the case, the state has not said that they want caregivers traveling to different sites to get their vaccine. They want it done here because that vaccine, it has to be entered in Show Me Vax. Whatever vaccine we get and administer, we have to request that number in about a week, and then about 3 weeks later, we'll receive that exact number to be given to those caregivers that received the first dose, to those that we were able to administer to, because it is a 2-shot vaccine, whether we get Pfizer or Moderna.
Just in general, could you characterize where COVID-19 is in this community, where we stand right now?
Right now, we continue to see about 1 out of every 3 patients that show up with symptoms testing positive. It's a little less than that now. It was around 34, 35%. Our numbers just through this week keep us at about 30%, which is nice to see a slight decrease. However, if you want to look back a few months, our positivity rate is certainly, much higher than it was. Right now, we're just kind of at a plateau, is where we are in the county and in the surrounding area, and I don't know that I can answer much better than that.
It seems like hospitalizations here have been somewhat stable, or they've been spiking in other parts of the country.
Correct, and I certainly have heard about that on the news. We had a spike a few weeks ago. As you all know, we were up to 90 patients, and that's dropped back down into the 60s. Earlier in the week, we were in the high 50s. We're kind of bouncing in that high 50 to low, mid 60 number. It's, I think that what has contributed to that, I think people are being much more vigilant. I do believe that people are wearing their mask and using good hand hygiene and being thoughtful about getting out. I'm glad to see that they can get out. I want them to be able to do that. But I believe that people having more clarity around the mask wearing and the hand hygiene, and I think they're being so much more thoughtful about that, because when they receive the information of the increasing numbers across the county, I think that it really set forth in them the knowledge that, hey, I can make a difference if we'll do this. Masks aren't going away for a long time. Just because the vaccine's going to show up here, I want you to know we here at Mosaic will be in a mask all next year. I just do not see us not having a mask for the next year at least, just because of the timeline it's going to take to get the majority of the population vaccinated.
How difficult has it been turning guidelines into who gets the vaccine first into a real life plan? Like, is it, obviously doctors and nurses are going to get this vaccine. Is it also going to be like an emergency guard as well? Like, is it everyone in the hospital? We have put a plan together based on what your risk of contracting COVID is. Obviously, we want to be able to vaccinate every caregiver that wants a vaccination. But the one thing that I want everybody to know, our nurses on the 5th and 4th floor and in our ER and our ICU are face forward, but don't forget our clinics. Every day we have our caregivers in our clinics collecting specimens on symptomatic patients at multiple sites. They too, we're trying to make sure that those folks
are getting the vaccine, along with, imagine dietary. We have people up on those floors delivering meals. We have people in those rooms cleaning. Even though they're not providing that direct patient care, they still are coming in contact. That's why we continue to limit visitation. And one other thing I could say to all visitors, masks are required in our facility at all times unless you are eating or drinking. So even if you are in a room with a loved one, your mask is to be on. We're not here to have you not wear your mask. We still allow some visitation, which many hospitals do not, and we want to be able to continue to do that.